professionals, dating professionals, you kind of understand, or I think, and the more I've realized this, anyone with anything in the sports world, you realize what you give up for anything, for family, for your significant other, for your career, whatever it may be that you choose for your passion, that you realize you sacrifice so much and you appreciate what the other person does for it. So I think Erik and I really bonded over realizing how much we were both so passionate about what we were doing and how hard we worked for it. And yeah, we were both just very respectful of each other's time and dedication to our things. Yeah, through dental school, I think it was just balance. And it really, really helped that, I mean, he was playing at least for the first 3 years where I was in school. So we didn't have to deal with long distance at first. It made my transition into the hockey world, I would say, a whole lot easier, a whole lot more naive, but a whole lot easier.
You're listening to Breaking the Ice, a podcast and community created for wives and girlfriends of professional hockey players, but since has turned into so much more. Stories shared by women around the globe who come together for a sense of connection and community. You may be in the sports industry, a hockey parent, an athlete, or a person who just enjoys podcasts, but I can promise you, you'll be inspired by these women every single day, while we evolve through the tips, tricks, do's, and don'ts for all things hockey. And guess what? So much more. For women, by women, but especially for a hockey community. So lace them up and tune in for a new episode every Wednesday. Thanks for listening. What's up, you guys? Welcome back to the podcast. I am going to just kind of come on here today and introduce my guest. I usually do a little bit of a longer intro, but I have actually had the stomach flu for the last 4 to 5 days off and on. So I am just like in straight recovery mode. I have heard it's been going around. I've gotten a few DMs from you guys that have also been dealing with this. I had it over Christmas. It has been absolutely awful. And I don't wish it on my worst enemy. So today I'm feeling a lot better, thankfully, but just kind of like exhausted and weak. So yeah, I'm just going to kind of get right to it today. I loved talking to Sarah on the podcast this week. You guys are going to enjoy this episode. It is super interesting because I've never really sat down and been able to have a conversation with a dentist before. She knows her stuff. So before we got into all the dentist stuff, we talked a little bit about her and her hockey journey thus far. Her husband currently plays for the Calgary Flames in the NHL. And he actually last season got traded to a different country, so the US, 6 days after Sarah gave birth. So he had to leave right away. She didn't get to see him for 5 weeks right after having her baby. So we talked about what that was like for her. We chat about what it's been like with COVID going on as a first-time mom. And of course, we had to talk about how her and her husband met during her very first week of dental school. I asked her what it was like, obviously both with high demand careers, high demand schedules, how her and her husband made this work. Like I was explaining to her that like even not having a career or not being in school, it was really hard to sometimes find that time for each other just with their schedule alone. So I can't even imagine what it was like having that with 2 crazy schedules. But they really supported each other and understood the importance of each other's careers. Then, of course, we dived into all of the questions about all things dental. We answered your questions that you asked. I had a lot of questions of my own. I have a ton of cavities. I like to say it's genetic, but who really knows? I mean, I think we can all do a better job at brushing our teeth. I will admit that. I asked her about cavities, if they're genetic, what you can do to prevent cavities. I asked her about any myths that she's heard that she can debunk for us. We talk about if sleeping with your mouth open at night can cause cavities. And then we talked about kids and their dental care. So me, as a first-time mom, I of course had questions because sometimes you read that you have to bring your kid to the dental office once they get their very first tooth. So I asked her what the real deal was with this and when you're supposed to get your kid into the dental chair. We talk about how to prepare your kids for their first dental appointment and to change the dialogue with them so that we're not implementing fear before they even know what really going to the dentist means. We talk about how fluoride is controversial and what she recommends, and so much more. So I hope you enjoyed this episode. Sarah is so sweet. I had so much fun chatting with her. And one final little piece that I wanted to mention is this is actually the last episode of 2021. And then I will be taking 2 weeks off of releasing new episodes because I'm going to be strategizing my guests and topics for 2022. So if you're interested in coming on the podcast in 2022, if you want to share your story, if you have a passion that you would like to share with our community, if you want to just come on and chat, fill out a survey. If you have filled out a survey in the past and I have not reached out to you, that does not mean that I do not want to have you on the podcast. I do get a lot of surveys. I'm very strategic with the way that I lay my episodes out and my topics out and guests, and I do pull like half of the guests from surveys, and I also reach out to people as well. So it's a really good combo of both. But if you have been kind of sitting on this idea that you want to come on the podcast, don't be afraid to fill out a survey, and I will definitely be in touch to record if it aligns with the audience. So thank you so much for all of your love and support in 2021. It means so much to me. It's just what keeps me going, honestly. I love interacting with you guys on the Instagram page. It gives me a passion and a purpose, and thank you again for listening in 2021. You are amazing. I'm so excited to chat with you today and just pick your brain about your hockey life and being a dentist and all of the things. So welcome.
Thank you. Thank you for having me.
So I always like to start off with asking people, a little bit of your background and just kind of what your hockey life has been like so far.
All right. Well, I grew up in a small town in Northern Ontario. I went to school in London, Ontario for my undergrad, and then I went to Florida for my postgrad, and that's where I met my husband. Since then, our hockey life has been a whirlwind, to say the least. We lived in a lot of cities. It's been quite an adventure. I'd say, yeah, we've experienced a whole lot in the time that we've been together, and it's been pretty exciting, and I've learned a whole lot from it, I'd say.
Yeah, I bet. And you guys are in Calgary right now, right?
We are, yes.
Okay. How do you like it there?
I love it. I love it. I'm lucky that I have family from here. My dad actually grew up here.
Oh, no
So
way.
when
Okay.
when we were younger, we'd come out every second year or so for Christmas just to visit family, but it's not a side of the family I got to see too often. So it's really nice to be out here and actually get to connect with them again and explore Calgary in a very different way now that I'm not so young. So I love the city.
Is it your first season there, or have you guys played there for a while?
First season here. We just started the beginning of this season.
Okay. Where were you guys last year?
Last year we were in Ottawa, and then we finished the end of the season in Nashville.
Oh my gosh. Okay. So you have been busy moving.
Yes, we should honestly own a moving company at this point, I'd say. But
Seriously.
it's crazy because I find the moves, you think they get easier and easier every time. Like I'd say I'm more organized every time, but it's still every time just a disaster. But
and
but
I
it
feel
works
like
out every time too.
I feel like you keep accumulating so much stuff too. I'm like, I thought we were like supposed to be getting rid of stuff, and every time we move, I find that we have like 4 more boxes.
Seriously, I don't know how you guys do that to Europe too. That's crazy. That's a whole other story. Like,
Yeah.
props to you, because I literally can't imagine. Like,
Well, we usually keep boxes here. Like we usually find someone we can leave our stuff with, or I know some people do storage units and stuff. It is hard though when you don't know. I mean, like we have had pretty much 1-year contracts every year. So whenever we go home for the summer, we're like, where are we going to leave our stuff? But every time when we come back over here, we have so many bags. It's just absolutely insane at the airport.
I feel like traveling even just for like a little trip with kids is enough, but like moving on a plane across to another, with kids is a whole other story. I don't know. That's impressive.
So you have 1 child, right?
Yes, we have 1.
Okay.
Yeah,
and
he's
it's
8 months now.
Because I saw on your Instagram one of your captions that said that he got traded or something when your son was 6 days old.
Yes.
Okay, please
Yeah,
tell me
that
all about that because that is absolutely insane. I don't know if I would be able to like function with that information.
Oh my gosh, it was pretty wild, to be honest. The whole time leading up to it, even like the last month or so of my pregnancy was pretty crazy. We were in Ottawa at the time and Erik was being scratched. We kind of had an idea that something was going to happen, but it was just such a mental roller coaster for him. And in a time where I feel like during your pregnancy, you're doing everything to lead up to the birth, like just trying to be so positive, trying to be in such a good place. And then there are just so many things that are beyond your control. And like that was a huge part of it. Like you can't control their career. You want to be there for them, but at the same time, you know that this baby's coming and you want to be in the best possible place for
Mm-hmm.
that. So that was a big challenge. And then luckily Erik trade deadline with everything that happened was a little bit later because our son was born 11 days late. So I went past due. And then Erik got to be there for the birth. He got to be there for right after. And then it was 6 days after 6 days after Benny was born that we found out Erik was traded to Nashville. So literally when it happened, Erik was like lying on the couch. I was just sitting. I feel like it happens with the past few trades that I've actually been with him for and I've been able to experience with him that I just like stare at him and like my heart drops. I like know something's happening, but you can't hear the phone. You're like, oh my gosh, like where are we going? What's happening? And he's just so stoic about it, like just so straight faced. He had Benny like on his chest. I'm like, what is happening
Oh
here?
my God. You're like in the background, like
Uh,
making hand signals, like, give me something,
yeah.
like, where are we going?
Oh my gosh. Yeah. You just want to know anything. Like your heart's just racing. You're like he knows what the next steps are, but you have no idea at that point. But as soon as he said Nashville, I knew it was a good opportunity because they had guys that were injured that they wanted him to help him to get them to playoffs. And he wasn't happy professionally where he was in Ottawa. So it was a really good move for him. I knew that. So I had to focus on, I guess, more so that. But it was really, really hard because I feel like, I mean, it's so emotional for a first time mom or anytime mom with a new baby, but
Mhm.
then seeing the way that the dads are with it's like I feel like Erik was even more emotional than I was in the first little bit and just seeing him with the baby and the baby on his chest is like finding out that he had to leave us and that we couldn't join him and it was just it was a roller coaster of emotions for sure.
Well, yeah,
um
now I'm thinking, I wasn't even thinking about that, but that's a whole nother element because you're obviously Canadian and then he is going to Nashville. So you couldn't get in
yeah.
literally to the country, right?
No, it's crazy. So luckily what could happen because of his visa and because we were married, I could get in through his visa, but we needed to have a birth certificate for our son. So we filed for an urgent birth certificate and then long story short, we were waiting day after day for the mail to come. Like I was stalking this poor mail lady. My mom and I would literally like run outside every time she'd be about to come. I feel so bad for this girl now. But what ended up happening was, I guess, because the house that we were living in was a newer address, and the week that the birth certificate was supposed to be delivered, there was a different mail person, and I guess he returned it. So we never ended up getting the birth certificate. So we waited for, I think it was 5 weeks before we finally just decided that we were going to try to drive to the border with any document that we could possibly have, trying to show that he's our son and that I needed to take him to the States. And then also because I had an emergency C-section and because Benny was so young, he couldn't fly because he had no vaccines. I couldn't fly because I was so quick post-op. I had blood pressure issues in the hospital and everything post surgery. So it was crazy. So my parents actually drove us down to Nashville. So we were trying to get Benny in without a birth certificate and trying to get my parents across the border, which they technically shouldn't have, but we got very, very lucky. So
Wow.
yeah, it was pretty crazy, but we got overall very lucky after 5 very long weeks of waiting.
Yeah. Oh man, I feel for you. That's tough. I mean, on top of just like giving birth and going through all that the first time, like I don't know about you, but like it all feels so what's the word? Like recent still. Like it goes by so
Yeah.
fast, but there's so many hormones too and like you're like crying all the time. I mean, at least I was, but it's just and then you
Yeah.
throw in like hockey on top of that and COVID on top of that too. And
Yeah.
how has that been for you as a first time mom and COVID going on?
Oh, honestly, I feel like I mean, we're lucky for when I guess we did have him that we went to Nashville. We were there for I think just over a month and a bit, and then we got to have summer. So Erik got to be around for the whole summer with
Oh,
him. So
good.
that was so special. I literally can't imagine if we just had him before the season. I mean, especially coming back after last year and after just travel being different, everything, like at least here in Calgary, the guys have been gone pretty much the majority of this first part of the season. So you're basically just going straight into like single
Mm-hmm.
parenting, which is a whole other
Oh,
story. And
yeah.
it's, yeah, it makes you appreciate moms and everyone around the world that's doing these things so much more than you ever imagined before. So it's been very, very eye-opening. And it's been, I don't know, that's been an adventure, that's for sure.
Yeah, I know. It's hard too to know what to do. Like when you have such a young child and there's so much fear in the world right
Yes.
now, and it adds a lot of just stress on top of the stress of just being a new mom in general, I find.
Oh, big time. Yeah, so much is unknown. It's crazy. And anytime, like even if they get like a little cough or a little something, it's like it's your baby and it's their first time experiencing any of this, and you get so worried for them. It's wild.
Yeah. Well, and I don't know if you guys had COVID, but I'm curious, like, did your baby going up getting COVID?
So all we all did. I mean, we were in the house together before we found out it spread like wildfire through the team, like very, very quickly. So I mean, there was really not any way for us to avoid that with him out here because we had to be with him.
Yeah, of course.
Um, so he had honestly, we got so lucky, and this is what we were told to, and we're grateful for that, but that it doesn't affect babies or young ones as much. But again, there's still so much unknown because this variant's so new. So he had one day where he had a very, very, very low grade fever, like barely even anything. He like literally coughed twice, and we were like, oh gosh, is he starting to get this? We were getting so worried. So we just like monitored him all day. He was a little bit off, but nothing too crazy. He just like wasn't as hungry as usual, but he was still drinking. He was still fine. And then we went in and checked and like felt his forehead every 2 hours through the night
Yeah.
just to make sure that he was doing okay. And honestly, that one day of being a little bit off was the extent of it for him. So we're very, very grateful that that's all it was. But it's crazy when you're not. I mean, we're lucky that Erik didn't get symptoms too bad at all. Like he had a little bit of a runny nose and fatigue, but beyond that, not much. I had a couple of days where I was pretty much the works of symptoms. But
Yeah,
then
like
after
all
those
of it.
first 2 days, yeah, all of it. And like the body aches and the fever, especially when you're trying to take care of a baby, you feel so much guilt and it makes it even harder. So that was really hard. And then just the worrying about him. But luckily he's okay, and he didn't get too sick. So
Oh,
we're very,
good.
very grateful for that.
Good. I'm so glad. It is crazy how quickly it spreads through the team. Like our
Oh,
team hasn't had it this year, like it hasn't gone around, but last year when I was 36 weeks pregnant, literally the entire team and all of the wives got COVID, like except me. It was
no.
insane. I never got it. And
Oh my goodness.
I don't know how, because they had a baby shower for me literally the day before they all tested positive, and I was like just sitting in the middle of all of them. And then my husband had it, and we were in this tiny apartment, and I made him sleep on the couch. But I was like, I don't know how I didn't get it, because I got tested a few times throughout that
Oh
span.
my
But
gosh. I cannot
yeah,
imagine the stress of that. That's crazy.
yeah. And so then, like, before they found out, they were playing a team who they all had it. And then we played another team, and then they all got it. So it is like insane how quickly it spreads in team sports like this.
Oh yeah. It's wild. Like within a matter of 3 days, everyone but three guys on Erik's team ended up getting it. It was crazy. Like from the time we found out, and luckily everyone, as soon as like we found out the first three guys had it, everyone isolated, and we were able to contain it past that point. But it was, yeah, it's quick.
It is. Yeah. Well, I would love to talk about your journey into becoming a dentist. I think that is so cool. That is amazing. And I'm just like fascinated with this topic. And okay, so let's backtrack. Did you start this before, like, were you in school for this before you met your husband? And also
I,
just with his career and how crazy hockey is, obviously. And dental school, I'm sure, is not anything easy. So how did those two go hand in hand, and how did you make that work?
Yeah, so we met when I was actually in my first week of dental school. So I was going through a crazy, crazy, terrible breakup at the time, to be honest. And I had a friend that moved down to Florida. I grew up growing up where I did. It was such a small town. It was an amazing small town, but it was cold. So I had like a childhood dream of going to school in Florida, and it weirdly somehow worked out. So it was my first week down there, and I literally didn't know anyone in the school there. I was starting completely fresh, and I had a friend that was coming to visit. Um, she started dating basically Erik's roommate. So that's how we met. So it was right in the beginning of my dental school journey that we did meet. We started dating, I think it was about like 5 or 6 months after we first met. We just saw each other a couple times from then on. And then it was like once I was finally over that whole messy situation that we had like a beach day, we started talking, and then we just never stopped. But yeah, I'd say it was very different. Like I didn't understand, or I'd never really experienced or known anyone part of the hockey world before that. So I didn't know what their career entailed. I didn't know anything about that. And I was first year dental school. So it was like right. And I mean, not that any year of dental school is easy,
Yeah.
but first year especially, it's like, like, welcome to this. Like,
Yeah, your
it
life
was a
is over
lot.
for the next
So
however many years. Like this is it.
yeah, you eat, breathe, sleep, teeth all
Yeah.
day, every day. Like I remember I'd go to Erik's games whenever I could. I'd like show up straight from clinic. I'd like have my scrubs on, have to like change, like bring a change of clothes down into the room and like change to go up to watch the games. I'd go through security to get into the parking garage, and like I'd have teeth in my trunk, and the guys would be searching. I'm like, I'm sorry, you're gonna find weird stuff back there.
Yeah.
Like, I
That's
don't
hilarious.
know. But yeah, I don't know. I think just being a professional, dating professionals, you kind of understand, or I think, and the more I've realized this, anyone with anything in the sports world, you realize what you give up for anything, for family, for your significant other, for your career, whatever it may be that you choose, for your passion, that you realize you sacrifice so much and you appreciate what the other person does for it. So I think Erik and I really bonded over realizing how much we were both so passionate about what we were doing and how hard we worked for it. And yeah, we were both just very respectful of each other's time and dedication to our thing. So like in the beginning, he would help me study for my exams. Like I remember it was like first year, so I had a hygiene exam at that point. I had to memorize certain instruments. He was helping me to like memorize the instruments. It was so cute how much he was just like just
Oh,
trying to be interested in something that was definitely not interesting to him at all.
that's so
um
sweet.
yeah, so that, yeah, through dental school, I think it was just balance. And it really helped that, I mean, he was playing at least for the first 3 years where I was in school. So we didn't have to deal with long distance at first. It made my transition into the hockey world, I would say, a whole lot easier, a whole lot more naive, but a whole lot easier, at least having my own group of friends from school there. And then slowly integrating into the hockey world and starting to understand that. I mean, I feel like I'm still learning to this day. There's how much
Always.
is involved. It's crazy. But it was, yeah, in my third year, it was the summer of my third year that he ended up getting traded to Vancouver. And it was while he was actually on a trip with one of his friends in Africa. So he didn't find out until the next day after he got traded. So I was the first one to find out. So
So
I got
you
home
knew
from,
before him.
I knew before, the world knew before him. Like he had no idea
Oh my
until a day
God.
later. It was crazy.
You're
So
like,
I'm like at our
welcome to
apartment.
your cell phone. Like,
Yeah, seriously. Oh my gosh. He was on like a riverboat cruise that had no Wi-Fi or no service. And like classic Erik, he's not like, he uses his phone for Candy Crush, and that's honestly about it. But but yeah, he did not have any idea. So I'm like on the bathroom floor crying. I'm like, oh my gosh, I'm like, I have a whole year of school left. I'm stuck here. And like he's going literally as far as he possibly could be going away from where I am now. So it was pretty crazy. But we did long distance for a year during my last year of school. But again, last year it was good because I got to really put everything that I had into like seeing as many patients as I could, getting the most out of the school experience that I could, which was awesome. And then I met him in Vancouver the next year, and that's where I actually started working, and was out in Vancouver. So I worked for two amazing dentists in that city, and I was so lucky to get a really good foundation for 2 years before all the trades started happening.
Yeah. Yeah. I mean, it's kind of a blessing in disguise in a way that you were able to like have that time to yourself to really focus on school and finish it. But I also think like, because I've done long distance as well. And although I wasn't like, invested in a career at that point, it was really hard just with his schedule only to find time to
Yeah.
talk because they're so busy. So what was that like with your schedule on top of that and trying to like intermix the two? Did you guys ever have like issues trying to find that quality time with each other?
Yeah, that year was really, really tough. I mean, I'd be in school from like 8 a.m. to 3 nights a week. I'd have night clinics. I'd be there till like 8 p.m. And then he was in Vancouver. So there was a 3 hour time difference. And then their hockey schedule. He ended up actually getting injured that year, though. So he had a surgery in New York or two surgeries in New York that the team actually flew me to be his like supervisor or to like help him through the surgeries, which was kind of crazy. So we at least got a little bit more time together during most of it. But yeah, it was a really, really hard year, especially when you can't talk to your person all the time. You're going through so much. I mean, I was going through everything with finishing up with dental school, the stress of like boards, of all the final assignments, all of the finding patient for boards. I was doing Canadian and US boards that year too. So it was quite the
Wow.
roller coaster for me. And then Erik was going through a really hard time too. At the same time that he ended up getting wrist surgery, he sprained his thumb on his other hand. So he literally could not do anything for himself. And I wasn't there to help him. So it
Couldn't
was,
even play Candy Crush.
no, he couldn't do anything. Like
Oh
nothing.
man. That's hard.
Yeah,
That's
poor
really
guy.
hard. And I feel like too, when they get injured and they're out, that like doesn't help their mental state either. And, I'm sure it was hard for him with you being so busy too. It's always just so
Yeah.
tricky. It's like, seems like there's never just like consistency, which is so tough with hockey. And that's really amazing that you're
No.
able to just like stay so devoted and dedicated to, finishing school. And so when you
Well,
finish
thank you.
school and he's like obviously just starting to get traded, like it sounds like how many times have you guys been traded?
So we've been on 7 teams now.
Okay.
So
Okay. So a lot.
yeah. So yeah, we got lucky that again, when I moved out to Vancouver after I graduated, I had 2 full years of work there before moving, which was so lucky. So I got like those 2 years, I was working like 6 days a week, getting in as much as I possibly could have. For my first 2 years, those were, I'd say even to be honest, harder than the year that Erik and I spent apart for both of us, though, because we probably saw each other even less, even though we were in the same city. And we both, I think, individually went through a lot more. Like me starting out with my career, with the stresses of that, with, I think when
Right.
you're starting out with anything, you're just so hard on yourself. And I mean, I'm type A to begin with. So every little thing you just lament over and you go on and on. And you're just learning to process and learning how to deal with the stresses of working in your actual profession. And then for Erik too, he ended up with another surgery after that first one, and just even going through the recovery and the mental strain of that. And then the hockey market out there it's a very stressful hockey market too. So there was a lot that made it a very, very challenging, I guess
Y-
I'd say, start to my career, to our end of long distance, and
Yes.
a difficult point in his career there too. So I'd say Vancouver was a big learning piece for both of us. Like we look back now and we're definitely way better from it. We've learned a lot from going through that, but you definitely don't get the warm fuzzies thinking back to
Yeah.
those days. That's for
You're like,
sure.
it made us stronger, but we don't want to do it again.
No, well, one and done. We're good.
Yeah, exactly. So what does that look like with you finding jobs and being like a hockey wife too? Like, do you stay somewhere? I mean, you're obviously with him now, and you just had a baby, but like, how are you going to navigate that moving forward?
Yeah, so everywhere we've been since Vancouver. So luckily, we went home for the summer. After that, I got a job that I absolutely love just north of Toronto at an office, and I've been working there since, until having the baby this year, obviously. So I did get my license in Pennsylvania, but it came in just in time for us to move to California. So I found like a dream job in Pennsylvania. I was so excited to start. I was supposed to start the day that Erik got traded, actually.
Ugh.
So I'm lucky that because I did my schooling in the States and I did my US and Canadian boards, I can technically work anywhere. It's just the logistics of it and actually obtaining the licensure that's a kind of a nightmare too, a little bit. Like it's a lot of work. It takes a lot of time to get the licenses. Like, for example, even in Alberta, which you'd think should be easy. I've had my license in BC, my license in Ontario. Now to get it in Alberta, I applied starting when we first found out we got traded here, and I'm still waiting on one form to come in from Pennsylvania. And I think this is more of a COVID related thing, but still waiting on a form to come in from them just to say that I'm in good standing in a state that I've literally never worked in, so that I can get my license here, which is crazy.
So just like a slow process to get things moving.
Yeah, very slow process. And then when it comes, Canada's lucky that as soon as I get a license, I can technically find a job, work anywhere. With the US, you need to have a letter from the employer stating that the reason why you are needed for that job over an American, and then you need to apply for the visa. And it's a whole other can of worms, but it's possible, which is the good thing. It's just jumping through hoops and finding the right people and right situations that'll make it work. And then also realizing that you may end up getting a job and then he gets traded the next day. So
right, which is hard because you get excited, like you said, and then it's like a little bit disappointing when it's like, oh, okay, well, I can't do that again. So, but obviously like you have that, like you are a dentist and, you can do that like long term too. It's not something that is going to go away. So like whenever he retires too, hopefully you can find a place that you love that you can, work at, or even like your own office. Is that like a goal of yours?
Yeah, I would love to eventually. I'd really love to. I mean, I feel like at this point, one of the most amazing things that I've gained from working in so many offices, like I was able to work in Ottawa when we were there too. And then even through just the applications that I've done in the States for certain jobs, like I found certain things from each practice that I love. And I did grow up in a dental office too, working for my parents. So I've kind of seen so many different aspects of the way that a dental office can be run, and the way that you can kind of work as a team to create such a good work environment for people. And it's way happier of a place for patients. So I would love to eventually be able to incorporate all of these little things that I've seen different places and little things I've learned along the way to have something kind of my own, but a couple years away from that at this point, I think.
Yeah. Well, I have to tell you, I have like 7 cavities. It's so bad.
You do?
Yeah. You're like, I have to go. Honestly, I'm getting off the call.
No, I have to say you're not alone. Everyone with the pandemic, it's crazy because that's the one thing that everyone, I mean, first of all, everyone had to put it off. We were shut down for so long, but you're so not alone right now. Do not feel bad about that.
Okay. I'm going to like pick your brain about like just questions I have that like, I feel like a lot of people will have questions too. And I know a lot of people threw in questions about kids because there's so much, I don't know, you read stuff online and sometimes I feel like, well, what's the real answer? So I'm glad I have you on here because I'm going to ask you.
Perfect. I'll give you my best answer.
Perfect. Okay. So true or false? Is it true that you can get cavities by the way that you breathe? Like I've heard that sometimes if you sleep with your mouth open at night, it can cause cavities. Is that true?
So yes, I would say yes, because so the more salivary flow that you have, the less chance you are of having cavities. So dry mouth does make you more prone to bacteria buildup and to that acid breakdown from the bacteria. So yes, in a less, I guess it's a more of a simple way of saying it, but yes, you can for sure.
Do you think that cavities are genetic? Because my dad, he gets a lot of cavities too, but it's just weird because I brush my teeth twice a day. And then my husband literally brushes his teeth once a day, never has had a cavity in his life.
This makes us as dentists so sad to see, but yes, there is definitely a genetic component to it. It's like the saddest thing in a day when I see a patient that like tries so hard, does everything possible to prevent cavities, and then just keeps ending up with them, and their partner comes in and does absolutely nothing, and you're like, okay, your teeth are perfect.
Yeah,
It's literally heartbreaking.
It's beyond unfair.
And then I see the patient with perfect teeth and I'm like, oh my gosh, I love you. You made my day. But yeah, it's unfortunately there is definitely a genetic component to it. There are a lot of little things or little tricks that you can do to help to prevent cavities.
Ooh, like what?
Like again, like you were talking about, like if you're a mouth breather, if you have dry mouth. So there are certain things that you can get to help increase your salivary flow. Whether that even be just like there's like a biotine rinse that you can get that just helps to keep your mouth less dry. There's xylitol, which I love to recommend to patients. It's a great one. So do you want me to get nerdy on you here or
Get nerdy? Let's hear it.
Okay. So I love xylitol. So basically it's a 5-carbon sugar. The bacteria that cause cavities, they can't break it down. So it actually helps to prevent that bacteria from producing the acid that causes cavities. It also helps to increase salivary flow in your mouth. So you can find xylitol in like little mints, little gums, but xylitol is a really good thing. That's a simple little kind of sugar alternative that can help prevent it. Another one, and this is a touchy subject, I know for sure, is fluoride, but fluoride does help prevent cavities big time.
Okay, so why is this a touchy subject?
So there are so many that are against fluoride or against fluoride in the water, because if you were to ingest large amounts of fluoride, yes, it is going to be a toxin and it's not going to be good to your body. But with the small amounts that are needed to help and strengthen your tooth structure, to help minimize cavities, and weighing risks and benefits of having active bacterial growth and active decay in your mouth and possible infection versus the small amount of fluoride that you need, fluoride it's a great thing. So I'm sorry for the people that don't believe that. And again, do your research, ask your own healthcare professionals. Everyone does have their own opinion on this, but for the most part, almost most dentists will agree that fluoride is very beneficial. Like when I was working in Vancouver, there's no fluoride in the water there. And the amount of patients that we'd even see move in from Australia, Ireland, the UK, just that had never had cavities before, moved to Vancouver and within a year had so many cavities. It's pretty crazy. So fluoride does really help. There are fluoride rinses that you can get as a supplement. So you just rinse, swish, and spit, and they do really help. Especially if you're high cavity risk, it's a huge thing that can help just to keep you happy at the dentist and keep you away from the dentist more.
Okay. So what does your I literally almost just said skincare routine. Like, okay, so like what would you call that as a dentist? Like your teeth routine, or like what does that look like for you every night or every day?
Oral hygiene routine.
Yes, there we go.
So flossing just once a day. So flossing is important at least once every 24 hours, just to break up that bacteria that does form between the teeth before it calcifies or before it hardens. That way you're able to get it off with floss. That's where those regular cleanings are important, just because that calcified plaque is really, really hard or next to impossible for you to get off with floss. So flossing once a day, that's all we ask. And then brushing twice a day. So morning, night. And then another big one that is really important that is harder to do is making sure that the brushing does stay half an hour away from coffee, or if you're having anything severe, like strongly acidic. So if you wake up and have lemon water first thing in the morning, just making sure you're not brushing your teeth immediately after that.
Oh, okay.
What else?
What about water? Like, can you, if you brush your teeth and have water right after, like in the nighttime, is that bad?
No, water's fine. I mean,
Okay.
if you're
My
having,
husband
if
says
you're
that, so I'm going to tell him. I'm like, no.
if you are if you're using a fluoride toothpaste, you do want to wait half an hour before having any food or drink, ideally, but it's water. And if you're going to do that, there are far worse things that you can do. I would never say that that's an issue.
Okay, good. He probably just made that up. Like I've never heard that, but
he's definitely not wrong. He's being like overly right, probably. So good for him.
and also like maybe I should listen to him because he doesn't have cavities, but
yeah, he's doing something right. That's for sure.
Yeah, he's like, you need to do nothing because I don't want to spend any more money at the dentist because you literally have like 3 cavities it's so bad. So like when I went to the dentist last time, I used to be really good. And let me just preface this with, this is when I was on my parents' insurance. I would go every 6 months. Obviously, like now I don't have dental insurance. And I think I was on it till I was like 26, which is crazy. And now I'm almost 30, but like, it was just weird because I was so consistent with it. And then but I've always had the cavities when I go in. And,
Yeah.
so I went in when I was pregnant, and then they were like, okay, you have like 5 cavities, I think. Yeah, they said like, okay, we don't want to do it right now because you're pregnant, but come back after you've had the baby and we'll get the fillings done. And I'm like, okay, great. Of course, I'm just like a procrastinator, and I still haven't gone back, and it's been like a year. So my next question is, when is this going to turn into a root canal?
Okay.
How long do I have
So
till I have to go?
loaded question. I would always say the sooner that you can treat anything before it gets too large, the better. And the more time and money it's going to save you too. So prevention in dentistry is key. It saves you time and money in the long run. The more that you can stay on top of the little things before they become big things, for sure.
Mm-hmm.
That being said, being a new mom, that is definitely the last thing that's going to be first on your mind, is taking care of anything for yourself. So I completely understand that. And then on top of that, moving different places, not knowing your healthcare providers. There's so many other factors that come into play. So don't be too hard on yourself, because it's not easy.
Well, it's
I'd
the main
say,
thing for me is it's so expensive. You know what I mean? Like, and I'm trying to figure
yeah.
out if dental insurance is worth it. But if you're someone like me that gets so many cavities, I'm like, I feel like it's worth it probably. But anyway, sorry, totally just cut you
Yeah.
off.
No, that's such a tough one. So if you are to hold off on dental care for any amount of time for whatever reason, because life happens, and that just is something that people do have to deal with. You can't always get things done right away. Just making sure that you're very diligent with your flossing, that you are using a fluoride toothpaste once a day. So like Prevenant 5000 at least is the one that you can find here. I'm not sure what it would be in Europe, but I can look that up for you. But using a fluoride toothpaste once a day, if it's a small cavity, usually once at the point that we say we're going to treat something, it's past the enamel, so it's to the inner structure of the tooth, and it is spreading. So fluoride at that point isn't going to do too much to prevent it, but again, it can help a little bit. So using that, using a xylitol mouth rinse, or using a rinse that has xylitol and fluoride, a combination of that can be great. So the one I always recommend for that is OptiRinse. But just doing those little things, and then again throughout the day, just making sure you're drinking as much water as possible, or just if you are having more acidic things throughout the day, like a lot of our healthy diets that we do, we use a lot of lemons, we use a lot of salad dressings, we love fruits, a lot of things that these bacteria break down to produce acid that causes these cavities. So the more that we can keep the pH in our mouth balanced by just swishing with water after these things, can again help keep them from spreading or getting far. So as for when it's going to turn into a root canal for you, that's I really hope not. That's really hard to say. Again, everyone's mouth is different. Cavities progress at very different rates, so it's hard. So the only way to really tell what that would be an X-ray. And again, even from an X-ray, it's very different inside the tooth. It's generally deeper in the tooth than the X-ray looks. But do all those things to help minimize or prevent it from spreading as much as you can. And I'd say
And go
get
to
it
the
treated
dentist and
as
get it
soon
filled.
as yeah, and that sorry.
Yeah, there's
I
one
wish I
that's
had a magic cure for you.
I know. I'm gonna have to just fly you out here, just work your magic, and then. But yeah, I
I'd
think
love to.
there's one that's like bad. I'm like, I know, because I can see it, but the other ones are like teeny tiny. They said, but like this one is like, I need to get it filled like ASAP. But
Yeah.
I was gonna ask you, are there any funny myths that you've heard that make you laugh that are just so false about teeth?
Oh my goodness. I'm trying to think. I mean, one of the offices I worked at had a very large Italian population. So the amount that would have like toothaches and just like, oh yeah, I just swish with some cognac and it's fine, it's done, no problem. That I've heard people like putting, this is gonna sound awful, and I don't know why anyone. And if you've never told the dentist this, I'm sorry, I probably shouldn't repeat this, but that people have literally tried to put like cocaine or put different things onto toothaches. And I'm like, why are you telling me this right now? Like, this is
What?
when I was in dental school that somebody told me this, and I had to go to my professor. I'm like, I don't know what to do about this. Like, what
Yeah,
do I
just put
say?
some Coke on my tooth. Like, are you kidding me?
Yeah. I mean, it is it can work as an anesthetic. Back in the day, they used cocaine, but yeah, we're not going to get into this. But yeah, just things that are like, why are you even bringing this up? I'm trying to think. I feel like the amount of things that I've seen over the years
How many
that make you
people do
shake
you
your head
ask,
are
like, how often do you floss? How many people say, oh, like every now and then? I'm like, no, I need to, like, I
yeah,
actually am not bad. I used to be really bad. Now I'm like, I try to go every couple days. I really should do every day, but I've come a long
you're
way.
trying your best. That's all that matters.
Yes.
Yeah, you know what? Honestly, for the most part, and I love this, but patients are pretty honest with that, and I really appreciate it. So, like, I find for most that'll say, "Well, honestly, I've lost the 2 days before I came here, and that's about it." I'm like, "Well, here's your clean slate. You're off to a good start. You're gonna have the cleanest teeth ever when you leave here today. So let's use that and let's go from here."
That's
But
actually so funny because I feel like whenever I go to the dentist and I know I'm have a dentist appointment, like I'm really, really good about flossing and brushing. And I'm like, okay, like they're going to say I'm doing so well because like my mouth is just going to look great because I just went to town these 2 days, but no. They
yeah,
know.
we see these things, but you know what? We appreciate the effort, and that's all we can ask for.
So
If you've
funny.
made it to the dental office, you're doing a good thing. So we're never going to come down on you for that because you're doing an amazing thing even by being there. Like that was a big part of the reason I even went into dentistry in the first place. Is I mean, growing up, I never understood how my parents did that day in and day out. I'm like, how do you look in people's mouths all day, every day and treat teeth? Like I could never understand it. I loved science. I loved medicine. I love everything to do with the human body, but I could never fully grasp what my parents did every day.
Yeah. So your
And
parents are both
then
dentists?
they're both dentists. And my dad is like the sweetest. My mom is too, but my dad is the sweetest human you'll ever meet. And there were so many patients. I worked at their office basically from when I was probably too young to even start working at their office. But I'd see so many patients that would just be so grateful for them changing them from being so scared of going into an office to like, I don't know if they'd go as far as saying like they absolutely loved to go into the dental office, but to the point that they were so comfortable going in to see him and they felt so safe. And that like I see patients even like crying after being like so happy and grateful for what he did. So that was what
Oh,
started to change my opinion on dentistry and on how, yeah, I guess it is such a science. It's medicine, it's science, it's
totally.
art, it's everything in one. And if you can make something that isn't something that people traditionally love or love going in to see, and you can make it into a better experience for them and help to kind of change their perspective on that in a positive way, just seeing that impact, that changed my view on it. So
It is
I'm
true.
hoping that that's what I can give to my patients.
Yeah. I mean, it is true though that so many people are scared to go to the dentist. And it makes me wonder like why. I don't know if it's just like kind of a
Yeah.
thing as to when you were a kid and you remember, all the noises and the feeling on your teeth and stuff like that. But a lot of people are kind of like have trauma about going to the dentist.
Yeah, I think a big thing too is just pain management techniques and how far they've come over the years. The biggest thing that I see, especially, I love treating kids. That's one of my favorite things to do. And just seeing how many kids come in and they're already scared. But these kids don't they don't know any difference. They come in to see you, and if you make it a good, comfortable experience for them, which we have the ability to do now with everything that we have and with all of our little techniques and things and tricks that we can do. So if
Mm-hmm.
you can incorporate those things and in combination with the children not having a preconceived notion that dentists are scary, which is something that
Right.
we unfortunately do see a lot, where obviously it starts from the parents that they're kind of prepping their kids being like, hey, it's gonna like might hurt, and use those like kind of trigger words for the kids, and then the kids are petrified, but they have no reason to be because they never even gone through anything like that. So yeah, I think dentistry has changed so much, and the more that a positive story can be shared around it, or more that positive experiences can happen around it, and the more that pain management is used properly, um, the better experience that everyone is going to have, I would say.
Yeah. No, that's a good point. Cause I like just you saying that, like I could totally like innocently picture myself saying that for my kid's first appointment, like, okay, it might hurt, but but it's like you have to change the dialogues because you're like kind of implementing that, like, and putting that in their head before they even know, like you said, what's going on. So
Exactly.
that's smart.
Yeah.
Like, how do you think, I don't know, like, I don't even know if you have advice for this, but like, what's something that you could say that could potentially make it more of a positive experience before they actually arrive at the office?
I think a big one is just focusing on that we're there to help keep their mouths healthy. That you're going in, like, I'm there for you. I'm coming with you. I'm here to support you, but just to try to help make sure that everything in your mouth is going to be nice and healthy. That we're taking care of those bad sugar bugs before they get at your beautiful teeth, or just just little things
Mm-hmm.
like that. Just
I
trying to
love that.
use. And again, we don't want to mislead kids because I don't think that's in any way right either. Like you do need to, like when we're doing certain things, like when we're doing the anesthesia, we do prepare them for it. And we do use wording so that they know what's coming, but it needs to be in a way that doesn't scare the living daylights out of them, because that's not
Yeah.
fair for them either, right? So yeah, it's kind of balancing that.
I love that the way that you said that too, because obviously, like as a first time mom, I've never taken my kid to the dentist. I've only gone to the dentist myself. So it's like, I don't really know what to say in those situations, but I love that. I think that's so cute. Like the sugar bugs and just saying like, okay, they're here to keep your mouth healthy. Like that's just such a cute way to
Yeah,
introduce them, I
it's the
guess.
little things. And it's the biggest thing that I find with kids too is the younger that you can take them in, like generally, so the recommendation for kids starting to come in to get their teeth checked out is either 6 months after their first tooth erupts or at 1 year. But the earlier that you can get them into the office, even if it's with their older siblings, just to take a ride in the dental chair, just to get them comfortable with that environment, comfortable seeing the dentist, especially now that we're wearing, I mean, we always wear a lot of PPE, but now that we're completely covered up, but getting just comfortable with being in that setting, the happier they're going to be as they grow up, knowing that this is just a normal thing that they go do every 6 months, and that it's something that's important for them to be healthy. So
So that was actually my
little,
next
yeah.
question. I felt like you led me right into like the children topic, but so I cannot imagine my son sitting still in a dental chair right now. Like he is nonstop. Is that like, I mean, can they get cavities that young?
We've seen them, they can happen very young. Yeah, so yeah, I would never say no, because I have seen cavities in very, very young kids. They can happen basically at any time once the teeth are up. They're not as common in the front teeth, which is a good thing. So you've got a little bit of time there at least, for sure.
Yeah.
Um, but yeah, it they can happen at any point once the teeth start to erupt. So making sure that starting from a young age, that I find the best way with kids, especially with young kids, to get them into the habit of brushing their teeth every night is place them on your lap, their head facing up on your lap, and brush their teeth that way, so their legs are kind of facing down towards where your legs are facing. And just starting that every night. Like I do that to Benny already every night, and he loves it. But just getting into the habit of that, just to help them clean their teeth. And then once they're old enough, or once they're able to, let them kind of play with the toothbrush and work on brushing their own teeth after that, just to help with prevention. And again, as soon as they have teeth side by side, flossing is recommended. Harder again in young ones, and harder to keep them still. But
Like how young
another
would you say
thing,
for flossing?
so ideally, like as soon as they have the side by side, just so that they start to get used to flossing. Um, yeah, really as soon as they have any teeth beside each other, just to get them used to it. So even as young as 6 months, which sounds crazy, but just to
Okay.
start, it doesn't have to be the most
I'm like,
thorough.
okay,
It doesn't have
writing
to be
notes.
yeah, it does not have to be the most thorough flossing job. It's more so just getting them used to the idea of it, and used to the habit of it, and yourself used to the habit of it too, because it's another thing to add on to that crazy long bedtime routine or daily routine that
Mhm.
you're doing, right?
Yeah. And sorry, I cut you off. Were you going to say something else?
Um, I don't think so.
Okay. Um, okay. So they should be brushing their teeth every night, or we should be brushing their teeth every night. And yeah, I mean, he loves like the toothbrush. Like I feel like he thinks it's a toy. And like, I don't know, I kind of like do it for him for like a minute, and then I just let him like kind of play with it in his mouth or whatever.
That's
Um,
perfect.
yeah, and like he likes it because it's like something that I only give to him like when I'm actually brushing his teeth. So it's like, and it's actually kind of, side note, like this is kind of a tip, but once they turn into like a nightmare when you're trying to change their diaper, like giving them a
Oh my
toothbrush
God.
is like the best thing.
Yes.
It's the
They
best.
love it. It's crazy. Yeah, it stops them from like the wiggles all over the place, and well, not too much, but at least a little bit.
Exactly. And then, so someone asked, should kids have fluoride in their toothpaste?
So yes, a little bit, but the amount of toothpaste that you're using for kids is very, very minimal. So for like a 1-year-old or for under 2 years old, it's like literally the size of like a small grain of rice. So very, very small amount of toothpaste.
Okay.
And then for even older kids, it's like a pea-sized amount. So generally, the amount of toothpaste that we're using is usually too much for kids. So I'd say tone that amount down. But yes, fluoride does really, really help, especially in kids with pediatric teeth or with baby teeth. They're a lot more prone to cavities. So that definitely really does help.
Okay. And then the last question I have for you is, someone asked, give us the real 411 on essential treatment for us transient families. So I think that I'm like, I don't know if this is just like me. Like, I think that means like people that are going overseas. Obviously, it's like
Yeah.
harder to find. It's just more of a hassle, honestly, to find like doctors and dentists and all of that stuff over here, because it's like different language and all of that all of that stuff. So what, like, how often should your kids be going to the dentist? Every 6 months, like adults?
Yeah. So ideally every 6 months, because again, especially for kids, cavities can progress a lot quicker. So the sooner that you can prevent something from getting to be too large, the easier you keep the treatment for kids. Something with kids that works amazing is using the nitrous gas. So a lot of times with that, we actually don't even need to anesthetize or don't need to freeze the kids. So when they're small too, or when the cavities are smaller, it's way easier to keep the treatment simple for them and to keep it a much more, I'd say, pleasurable or much more enjoyable dental experience. So I'd say as much as you can on top of that every 6 months, or making sure that at least every time before you're leaving, and then as soon as you're back, if you aren't going to get a dentist over there, because I cannot imagine how hard that would be.
Yeah.
But at least doing that just to try to stay on top of it as much as you can does really, really help. It just, the biggest thing with kids is trying to minimize traumatic experiences when they're younger. Because as soon as they have one of those, or as soon as they have something that is more invasive or something more difficult done when they're younger, they do remember that, and it does make dental care harder for them growing up. They just come in and they're already a little bit, if they've had that traumatizing experience, which hopefully they never do have, but you want to avoid that as much as possible.
Yeah, definitely. Well, thank you so much for coming on and letting me just pick your brain. And thanks for sharing about your hockey journey. If anyone wants to follow you on Instagram, what is your handle? Where can they find you at?
It's at my name, at Sarah Sweetnam.
Okay. And that's like the cutest last name for a dentist ever. Do people say that to you all the time?
And they do, thank you. Honestly, I told Erik that I'll change my name when he changes my name. So I don't know if that's ever happening at this point, but we'll see.
Amazing. Well, thank you so much.
Thank you for having me. It was nice talking to you.